My name is Derek Bauer. I'm an assistant professor of neurology at the University of Virginia. There are many aspects of women's health that need to be considered in navigating epilepsy. One of the more important aspects that does need to be considered is the hormone changes that occur throughout a woman's cycle that may have an influence on seizure tendency. In general, it is recommended that you speak with your neurologist if you do notice any changes in your seizure patterns around the time of your cycle. This can be something that needs to be addressed through longitudinal usage or day-to-day uses of the seizure medications to ensure that the seizures are adequately controlled. Sometimes this may also require working in tandem with healthcare professionals that are a part of your treatment team to navigate things like potential of hormonal contraceptions and use of other potential interventions to help regulate cycle as a means to also help control seizures.
Well, I don't know if he did or didn't because of my memory, but I definitely learned that is definitely when I have my seizures. If I'm going to have one, they've all been 9 out of 10 during my menstrual cycle, definitely. Different people get different responses.
This is particularly important due to the potential interactions that contraception can have with seizure medications. The interaction risk is different depending on the contraception as well as the seizure medications. Depending on the situation between those two medications, it could result either in a decreased efficacy or how well the medication works for a contraceptive medication, or the vice versa of that is also true, that the contraceptive medication may have interference and interaction with your seizure medication and may decrease the effectiveness of a seizure medication. So if there's ever any considerations for changes to contraception or the addition of contraceptive medication, you should definitely make sure that your neurologist is aware of this.
Actually, with my contraceptives, I don't have any children, so they actually help during that time of the month. It kind of calms your seizures down a bit. So with mine, I have to make sure if I'm having sex or not. I don't have a boyfriend, but I definitely need that birth control. It does great things with your seizures, or they can mess it up really bad. But yes, I guess it's different people how things are done. Different people get different responses. Dating in epilepsy, the main thing is you definitely need to just be confident yourself to talk with them. So, and it also depends on the seizures that you have. See, I have focal seizures, so it'll be funny if I just suddenly he's talking and I just suddenly just stare somewhere off and it's like, what's wrong? So, but just it depends on your seizure. If you have one that comes along and you don't know when or something like that, you should definitely let them know. I would say maybe the first date with that one. But you have to be comfortable, because if you're not comfortable, you're gonna make him scared. He's gonna be there like, okay, was that a seizure? Was that a seizure? No, and you definitely let him know what to do if you have one. If he might get scared, tell him just say 5 minutes, or even if you get too scared, go ahead and call 911. Tell him also, if he calls 911, he is paying the bill for the ambulance. I like to have fun with mine. I like to joke and laugh because it makes people comfortable. So, but first or second date might be good, depending on your seizures.
Be sure to talk with your neurologist about the risk associated with seizure medicines and the risk of birth defects. All of our seizure medicines are associated with risk of birth defects, Each medicine has a different risk profile, and this should be a conversation that you have with your neurologist to navigate the proper medication choices and management over the course of pregnancy. Given the risk with seizure medications and the risk for birth defects, it is optimal to begin having conversations with your neurologist prior to becoming pregnant to ensure things like folic acid supplementation is started prior to becoming pregnant, and to get an understanding of the baseline or before becoming pregnant medication levels in your blood. However, sometimes that doesn't occur. Sometimes pregnancies can occur unintended, and it's an important concern, and as soon as you're aware of that, you should speak to your neurologist to make sure that they can speak with you about the risks of the seizure medicines, plans for monitoring your seizure medication levels over the course of pregnancy, and to come up with a safe treatment plan with you to ensure your and the baby's safety over the course of pregnancy. After pregnancy and delivery, there are many aspects that still need to be navigated from a women's health perspective relating to epilepsy. Importantly, there's a decision for breastfeeding and whether or not it's safe. Each seizure medication has a different risk profile from this perspective, and a different amount or relative amount for which it would enter into the breast milk. If you have any concerns or questions about breastfeeding while on seizure medications, it is recommended that you talk with your neurologist about this. In addition, if in the course of pregnancy, seizure medications are adjusted to allow for the clearance differences that occur during pregnancy, the seizure medications may need to be decreased to compensate for the changes that occur after pregnancy. During the course of pregnancy, many changes occur in a woman's body relating to how seizure medications are cleared. The kidneys and liver are working harder to ensure that both the baby and mom are taken care of. These changes can in turn influence and affect seizure medication levels. It's important during the course of pregnancy that you speak with your neurologist frequently and often to ensure proper surveillance of your seizure medication levels. This also can involve and should involve coordination between your neurologist and your OBGYN or your family medicine doctor, who may be helping navigate your overall general health during the course of pregnancy.
Me with exercising in epilepsy, that can affect anyone. I know myself, I actually can't do too much with my heart rate. If it goes up too much, too long, it does cause a seizure. I've had 2 or 3 because of that. Now that does not mean that you can't exercise. I did my yoga classes and the small classes. I have done it. It does work, but just be careful. Just be careful. Everybody's body is different.